Here's part 5, page 186, of bone tissue development and how does a long bone actually progress. And you can see it here in this particular visual where the disc here, which is hyaline cartilage disc, is becoming mineralized and so on, calcified on this side, and then extending out this way. And as it progresses, bone is added here, and then basically there's osteoclasts on this side that allows the chondroblasts on this side to extend the formation of the cartilage. So cartilage is sort of growing this way, but then losing its proximal side here due to mineralization of bone. And the whole process, the whole package kind of moves in this direction outward. Okay, and they're also showing us here that things can change in terms of gauge. So the size of a bone will also change with time, and especially as it picks up some extra stress or mass due to the increased size of the body. Okay, so then we have various homeostatic regulatory arrangements, and hormones play a role, and they talk about that right here. Bone, particularly there's growth spurts at various times of life. Puberty is usually a little bit coming earlier in females in terms of bone or skeletal growth than males, so maybe a year earlier in females, and females will get a little bit of lengthening going on, and then males more than catch up about a year or two later, as the male puberty is a little bit slower to pick up. Okay, so then we have a little discussion here about bone remodeling and repair. Ultimately, we're going to replace all of the bone in our body fairly quickly. It talks here about recycling every week. It says here we recycle 5 to 7% of our bone. So if that's happening every week, and we're looking at that, then somewhere between 14 and 20 weeks, we'll have completely recycled everything. Okay, and there is a saying with regard to fractures that it takes 100 days to completely remodel a bone after fracturing. Okay, and I make reference to that here. The distal part of the femur, its notes here, is replaced every 5 to 6 months. So you have that sort of sensibility of what's going on. Then there's bone resorption. That's part of the remodeling process. The osteoclasts engage in that. And also, if you're in negative calcium, blood calcium needs, then it's going to come from the bone until you can get it from the diet. Calcium is an essential nutrient in the diet. Okay, so we store it in the bone. The control of remodeling is discussed a little bit here with regard to hormonal feedbacks, and we get on to the parathyroid hormone balance with calcitonin. Generally, parathyroid hormone is activating osteoclasts to break down bone matrix and return calcium to the blood. Calcitonin is not exactly stimulatory, it's more what's considered permissive. And so it is permissive with regard to the uptake of calcium into the bone matrix. Okay, and then we do have a discussion here where we pick up with parathyroid hormone. And in parathyroid hormone is being released from the posterior aspect of the thyroid. And it's having a couple of things going on. One is that it activates osteoclasts to break down bone matrix and basically return calcium to the blood. Another thing is that it acts on the kidney, and it retains calcium at the kidney, preventing it from going into the urine and being excreted. And then we have vitamin D activation. So by activating vitamin D, we act at the gut level to promote uptake of calcium from the diet. Also, calcium is transported across membranes, usually, or in fact only, in the presence of activated vitamin D, and this is true of the heart. Okay, so we'll press on to number 6, or part 6 next.